Good morning, everyone, and thanks for joining. Just giving it a couple of seconds for others to join. But I have texted you on WhatsApp, and obviously, we will make a quick start. Um, if most of you recall, those who've been joining the session, that we are today looking at covering Learning Outcome 3, which is for the unit Social and Community Welfare Provision. This is the unit that we've been covering for the last 2 weeks, and today we are looking at covering Learning Outcome 3, which is the last learning outcome in this unit. And tomorrow's discussion is going to be on the assignment for this particular unit. So the third learning outcome talks about understanding the values that we look at, in key areas of the health and social care sector. When we talk about social and community welfare, we will look at person-centered values. We will look at NHS principles. We look at the 6 C's of healthcare. Those are the bits that we need to be touching on today with regards to understanding what are the values that are important in terms of providing and delivering health and social care services when we talk about social and community welfare provision. Now, there are two assessment criteria. First one talks about discussing the core values which underpin the social and healthcare service delivery. That is the first part that we're going to look at. And when we talk about, sometimes we use this word underpin. I just want to, obviously take a second or so and then explain what do you mean by underpin. Underpin is we are trying to look at supporting evidence. So sometimes when you do your assignments, you create evidence. What tends to happen is that we always use the term you need to underpin the theory, or you need to underpin the main theoretical concepts or frameworks. Now, what does underpinning mean? Underpinning means that you're looking at providing supporting arguments or material to be able to convince the reader or the person who's reading your evidence, or in this case, your write-up, to say that these are the reasons why you need to look at agreeing with me on this. So underpin, when you say underpinning something, that is to support, to justify, and to form the basis of. That is the dictionary meaning of the word underpin. So here, when we talk about the core values, essentially when we talk about and say discuss the core values that underpin social and healthcare delivery, what are we talking about? We are talking about providing what is called support, where by you giving enough arguments or enough evidence, maybe using justification by using an example, and in this case by supporting and creating or quoting an example for justification, we are going to support why the core values are important. Now, what are these core values? Core values are person-centered approach, 6 C's of healthcare. We will be looking at principles of NHS. These are the core values that are required to basically look at providing successful delivery of health and social care services. But when I say successful, what I mean by that is we are looking at that it benefits the patient. It allows the patient to get better. It allows the patient to go back to its normal state. If you've had an accident, if you've had an illness, you've had a prolonged illness, or you are dogged by, say for example, some say for example fever, flu, then the idea here is to help the patient by using the core principles of care, integrated care that we provide, to be able to help. That care should be helping the patient to get better. That is what we're going to be looking at when we talk about the core principles or core values. Core values, when we talk about briefly, just a few, if I have to name, core values will include values like dignity, respect, compassion, equality, looking at making sure that you're accountable, you are essentially working in collaboration, your person-centered values that we generally talk about in terms of independent decision making, sharing the facts, confidentiality, allowing the family members and the patient to be able to make decision rather than forcing a decision on them. These are the values that we are going to be looking at when we talk about inclusion, for example, in this particular context. The second part that we look at is identify and discuss the ethics that underpin the social healthcare service delivery. So when we talk about ethics in terms of looking at, what could be the core. When I say core, forget the word core because it's an adjective, but what we are looking at here is talking about the ethics, that we need to have when we talk about, providing health and social care services to patients. And in general, when we are working within any sort of a health and social care setup, like a care home, an old age home, or even working as a social worker, but you're providing services to people with the help of local authorities, councils, and other such community welfare provisions which are there in the society. So when we talk about essentially these core values, what we are talking about when we talk about these core values, we are looking at essentially talking about what is called the six core values of NHS. And in this, what we need to look at is the ethics side of things that we talk about. So when we talk about the six core values of NHS, we're looking at respect and dignity, commitment to quality of care. We're looking at compassion, improving lives, working together for patients. And this bit, wherein what we need to do is basically integrate the concept of ethics. So what we talk about when we use the word ethics, we are looking at ethical values and let's say the morals essentially which are required for us to be able to work in this particular sector. Things like integrity, honor, choice. We are conscious of some of the choices that the patients need to get, fairness, our responsibility towards the patient, and then looking at honesty and looking at choosing right from, being able to differentiate right from wrong. These are the various things that we will be looking at, how these principles of an individual are going to be ethically important for you to have these principles using ethics, then understand the core values of NHS, the person-centered approach, the integrated care that the system provides, and using them to be able to deliver care, or for example, in this case, care related services to patients. That is what we are going to be looking at covering today in the learning outcomes. Now, let's go into a bit of detail by looking at key terminology and also, discuss this in a bit more detail. So let me switch over to a presentation. Now, when you look at the presentation, what we are looking at here is primarily discussing, what are the core values? Why is there a provision required for these values in terms of everyone needs to understand before they even start working? They need to be able to align with these core values, their own personal, values and principles, their morals. Now, when we look at provision, this is something that we explained and discussed, in the first learning outcome, because the unit talks about welfare, social and community welfare provision. So the word provision is very important is because it looks at talking about the action of providing or supplying something, which means we are going to be looking at, say, for example, in simple words, making arrangements or preparations to be able to provide these services to members of public or patient. And a simple example of provision that I would do is, when we do it in our day-to-day lives, is when we talk about provision is, for example, you do provisioning of food or food-related items, grocery items in your own house. An accountant might do provision, or a business owner might do provisioning for salaries, various type of other inventory or other material which is to be sold from a shop. So provision is a very common word that we use, but we are going to use it in this context of health and social care. That means when we look at provisioning or provisions, meaning in the health context of health and social care, what we are looking at is the government making arrangements to be able to deliver, the healthcare services or social services, and these would typically be provided through local authorities, hospitals, surgeries, pharmacies, things like that. So when we talk about provision, we are looking at basically talking about any sort of service or every service which exists within the health and social care sector, and that would be used, or that would be provided to basically the patients or people who need care. And these services would be, some of them would be statutory, some of them could be voluntary, some of them could be delivered in partnership with private players, And some of them, these services could be social services, which are basically going to be provided with a wider infrastructure and network of local authorities, councils, and social workers, and community in general, where the patient or the person is essentially residing. So in terms of provision of care, what we are looking at is these are guiding principles which the government has created, or the Department of Health has, and that it uses to put the interest of individuals receiving care and support at the center of everything they do. So when we talk about the principles of NHS, which is working together for patients, talking about commitment to the quality of care, talking about compassion, talking about respect and dignity, these are the core values that we are looking at, discussing today in this learning outcome. Now, the provision, how do you make arrangements to be able to deliver these, services using these core values is what we need to understand. And when we look at the six core values, of NHS, and this is something which is what I've listed here. So if I put it down, respect, and respect and dignity, you have inclusion, you have compassion. So if I put that down here in a way, respect, dignity, compassion, these are bits that you need to know and you need to be very well aware of. So this is something, when I say very well aware of, you should know them by heart, because these are bits that improving lives. And then we talk about, working together for patients. And the last one is everyone counts. So they might be, say, for example, slightly worded differently, but you are going to see that these professional values or principles of NHS are the six core, values that NHS works with and has most of its operations, and let's say the most of the services that it provides, they include all these values, core values in its delivery. And whether it's a person working in healthcare, in clinical side, doctor, nurse, healthcare worker, occupational therapist, any sort of a role that you perform, you are going to be looking at understanding these six core values to be able to deliver and perform your basic roles and responsibilities. Now, there are lots of principles. So when we talk about core values, and when we talk about principles, there's a slight difference between values and principles. So when we talk about in terms of let's say values, we are looking at things which cannot be compromised with. That is the ethos of the organization. And when we talk about principles, what we are looking at is they are a part and parcel of what is called the system that the organization creates. So values could be subjective, they could be personal, and they could be emotional. But principles are always objective, factual, and impersonal. They are not going to be dependent on a person. They are not going to be dependent on a personality. They are going to be the founding pillars of the organization. So when we talk about the principles of NHS, and in general, when you mention that these are the core foundations of how the NHS constitution is formed, we are going to refer to the principles of the NHS. And these principles of the NHS are going to be independent of the person occupying the office, the operations of the organization in a particular location. These are going to be absolutely non-compromisable. So when we talk about values, and we talk about principles, values tend to be subjective. They can be applied in different situations. Interpretation of that could happen. They could be personally adapted by somebody, that my value is that I value honesty, or I place precedence or value, integrity. But when we talk about principles, we are going to be talking about the principle of NHS is that we will provide the right treatment. There'll be no compromise on the services being provided. We will not differentiate between people receiving treatment, and they are going to be principles. So they are going to be objective, they're going to be factual, and they are going to be indisputable. So that is the difference between the two. But when we talk about in this learning outcome, detailing in terms of what are the values adhered to in service provision, looking at core values, and then looking at ethics, we'll be looking at bordering and discussing both of them. So we'll be discussing values and we'll also be discussing principles. And that is why the difference between the two has to be clear. So NHS has seven, principles. Sometimes they're called, obviously principles of the organization can be expanded. But generally speaking, when we talk about a principle, a simple example that I will give you is sometimes we talk about it a lot and we say honesty is the best policy. That's a principle. So that is something which is non-compromisable. It is non-debatable. It is something which the organization or you as a person, when I say honesty is the best policy, you swear by. But when I talk about value, I can say I value honesty, because it helps me do this or do that or, get this. So there is a difference between when I say principle and value, because a principle suggests that in this case, honesty is universal, and the objective standard is to relate that to some sort of an ethical behavior. So if you're honest, that means you do things ethically, you follow rules, regulation, and ensure that you're trying to do your responsibilities or, let's say, delivery of your roles and responsibilities honestly and by the book. When I talk about value, in this case, what we will say is the individual's personal value of honesty is, sometimes based on the belief that it gives us positive outcomes, or it will give you, for example, a desired outcome that you're wanting to do. So I've always followed honesty, and I've seen that you might make a statement or you might believe that, I believe honesty is the best policy, which is the principle. But when I look at it as a value, I say, I normally follow the honest path because it helps me believe that it will bring out the best outcomes in me and the work that I'm doing. So slight bit of difference between principle and value, and that is what we need to understand when we look at discussing these two in the context of NHS and when we talk about social and welfare community provision. Now, when we talk about principles of NHS, there are obviously, seven key principles of NHS, and these principles of NHS typically tend to be, related to how the NHS constitution has been set up. So these principles are, talking about comprehensive service, irrespective of, your background, your race, your disability, your age, your orientation, your religion, and your beliefs. That is the first principle. The second one that they have and they talk about in the NHS constitution is the service that you need is not going to be based on an individual and the individual's ability to pay. NHS services are provided free of cost, except in a limited number of circumstances wherein there are sanctions, introduced by the Parliament. But NHS services to every member of the public in the UK who is residing in the UK, citizen of UK, are absolutely free. Then the third principle that they have is the NHS aspires to have the highest standards of excellence. So these are the seven principles that I've written down. So they aspire to have the highest standard of excellence and professionalism. Now, what does that mean? The provision of high quality care, which the NHS provides, needs to be safe. It needs to be effective. It needs to be focused on, patient experience, and it should help the patient get better after having some sort of, say, a clinical procedure or any sort of service that the patient has received, from the NHS staff or NHS facilities. And it when it also talks about higher standard, what it also means is that we are looking at, when I say we, I mean NHS is looking at employing people which will have the highest academic rigor. They would have proper training and they would receive development in turn to be able to, provide the services at the highest standard. They will understand the commitment to quality. They will understand the values which NSS, works with. And that would be the third principle, which is providing service at the highest standards. Then we talk about the NHS must reflect on the needs and preferences of the patient. So the patient is the heart of everything. That means providing the service to the patient is the core, ethos of the National Health Service. So here, the patients, their families, their carers, or people who are involved in providing care would be getting appropriate, resources, and they would be involved and consulted on all the decisions which are made about the care and treatment of that patient, so that the patient receives the best possible care, which will allow the patient to get better. Then we talk about, working across boundaries. That means, this is when I say working across boundaries, is there are no, hard and fast rules that the NHS cannot work with the private sector or other organizations in the interest of, providing the best possible services to its patients. So sometimes you would see, if there are long waiting lists and queues, NHS would prioritize and, fund the operations and the procedures that need to be done, if they can be done alternatively through private organizations, or if the treatment can be provided in a much better way by involving local communities and wider population. So this is where it means that it works across organizational boundaries. So this system, which allows NHS to use its principles and values, is now reflected in its constitution, and that is where it talks about across organizational boundaries. So the NHS works with the local authorities, wide range of public, private, third-party organizations at the national level and the local level, to be able to provide these services which will improve the health and well-being of the members of the public. Then sixth one talks about committed to providing best value for taxpayers' money, because these services are free. The funding of this is done by the government, and it is normally done from the taxpayers' money. One of the main principles of NHS is that it needs to provide the most effective, fair, and sustainable make use of sustainable, most effective, fair, and sustainable use of the resources that it has or it gets in terms of funding, because this is funded through the taxpayer in the country. So public funds are involved, and obviously the funds which are involved are solely devoted to providing benefits or care which is going to benefit the patients and the patient the NHS serves. And last but not the least, the seventh principle is that it is accountable to public, communities, and patients. So when we talk about, the formation of, if you recall, there were 4 reports that I'd mentioned. In one of the reports, if you look at the Griffiths report, it talks about, the NHS being allowed to form its management in the 1980s, and this formation of the management brought in accountability, so that they have provision and, let's say, freedom to decide where the funds have to be allocated, how the resources need to be allocated. But it also brought in accountability. So the NHS is accountable to public, the communities, and patient it serves. And this is the seventh principle, wherein it is, because it is funded through the taxpayer, and the government provides the policy and the framework for the NHS to operate. Some of them, and then there is a lot of freedom which the NHS has because of its own constitution and the management, to be able to run these operations. So that is where the system of responsibility and accountability for taking decisions in the NHS is supposed to be transparent, clear. Under the Freedom of Information Act, you can seek information as a member of the public, or as patients, as staff, and, hold the organization accountable to ensure that there is a very clear, up-to-date statement available for the actions that the people and the management take or work within the NHS. So these are the 7, principles of NHS, which basically are now enshrined into the NHS, constitution. So these are things that you need to be aware of. And when we talk about the NHS values, these are the 6 NHS values in detail. So again, there is a bit of an explanation that you can go through and read. And these are bits that, you should know by heart, because these are guiding principles and values which the National Health Service works with. And it expects that staff, employees, contractors, suppliers, patients, or, anybody which provides, not the patient, but anybody which works and provides in unison these services to the patient, needs to be aware of. They need to adhere to these, and there is no compromise in terms of providing, health and well-being services to the members of public with these values and with these principles. So that's the basic two things that we need to be aware of in terms of ensuring that when we talk about what are the values and what are the principles, and now we are going to be discussing with them the first criteria when we look at what are the core values, and in the second part we'll relate it to ethics, which are basically related to the principles and values of the NHS. While you work and you serve and you provide these services, you are going to be ensuring that you understand these values, you keep the principles, the core legislation, the core ethics, and the foundations of the organization in mind while you're discharging your responsibilities and providing health and well-being services within the National Health Service. Is that okay? Any questions on this so far? Any questions? Anybody? Anything? Any thoughts? Are we clear on this?
That's fine.
Okay. The difference between values and principles. We know what are the 6 values of NHS, and we know what are the 7 principles on which the NHS constitution is formed. And then we will go into the detailing of it. So the first assessment criteria talks about core values that underpin social and healthcare delivery. Now, as I explained to you, when we talk about underpin, what we have to look at is provide supporting arguments or justification that why these values are important in providing social and healthcare and well-being services from the NHS. Now, one of the main things that we do discuss when we talk about the values underpinning social and healthcare services delivery is that patients come first in the NHS. So the NHS is formed primarily to provide health and well-being services to patient. So patient is at the heart of everything. If you recall, that was one of the principles of NHS. So patient is at the heart of everything in what the NHS does in terms of providing services. So when we talk about patients come first in everything we do, we are looking at now understanding from a point of view of what the patients was essentially want. So first thing that we would relate it to is respect and dignity. That we value every person, everywhere, whether it's a patient, their family, the carer, or the staff. And as an individual, what we will do is respect their aspirations and commitments, and we will seek to work to understand their priorities and how these priorities and their needs can be fulfilled by providing the health and well-being services while maintaining the quality of care. That is the main essence of understanding why we need to have these core values and understanding of these core values, and using these core values. What we are going to be able to do then is use some of the legislation which has been passed in the Parliament to understand these values and then deliver the health and well-being services. So one of the things that we look at is the Equalities Act. So when we talk about, say, these values of respect and dignity, or we talk about compassion and everyone is treated the same way, we are referring to or talking, and in this we can relate it to another legislation or acts, which is the Equalities Act of 2010. The Equalities Act of 2010 says that everyone should get equal access to healthcare services, and it is regardless of their background, gender, ethnicity, religion, belief, or any sort of personal characteristics. Now, this principle reflects the policies, the use of this act actually reflects on closely reflects what are the principles of NHS. One of the principles that it talks about is that patient is at the heart of everything, and the other bit was that NHS provides the services to everyone without any differentiation. The first principle is it provides comprehensive service available to all, and the second is a patient is at the heart of everything. So this particular legislation relates to that, and it covers or kind of looks at two different principles of the NHS. And if we cover this and say the word equality or Equality Act of 2010, then what we are looking at is anyone working within the NHS is then looking at not, or basically when I say in a positive spin or a positive manner, that the person would be looking at following the two principles if they keep the Equality Act of 2010 in their mind, which means that no person, would be discriminated against or would be differentiated against on the basis of their background, race, gender, ethnicity, or the culture or the values or belief, religion they have. And that would help the person, say, for example, a healthcare worker who's providing or is working to provide care to the patient, to adhere to two of the NHS principles and the core value that, everyone would be given respect and dignity. So it relates to one of the values, which is respect and dignity. And on the principle side, it relates to, everyone, the service from the NHS is available to everyone. And the other is that patient is at the heart of everything. So without any differentiation and discrimination, these services would be provided. Now, we also talk about patient-centered care. Now, the reason why we talk about patient-centered care and patient-centered care theory in particular is because this approach emphasizes that we are going to treat individuals receiving care as active participants, because you cannot provide care to an individual or a person until unless you have participation from them. You have the ability wherein, not the ability, but the patient or the person who's undergoing treatment is cooperating with you. So in this case, the person who's receiving the treatment has to be an active participant in their own care. And then what we can do is we can then focus on their preferences, needs, and their values. So person-centered care becomes important because we need to put the needs and preferences of the individual at the heart of everything, in terms of at the center of everything that we are doing. And this would also allow, because you're taking the person's need and preferences into account, this would also have interest from the patient, wherein the patient would take active interest and participate in the activities that are being planned, or the care plan which has been put together. They would be involved in this plan to be able to, treatment plan or the care plan, to be able to get better and obviously receive the effective treatment which is required. So when we talk about person-centered values, what we are looking at is, we are, from a value perspective, committed to providing them quality of care. The care that we are going to provide is going to be adhering to some sort of quality standards, and we are committed to the quality of care as per guidelines which are set by the NHS Constitution and also by CQC, which is a regulator. But at the same time, what we also want to do is, in delivering these services to the patient, what we are going to do is make sure that we have the highest standards of excellence and professionalism, so that the patient feels empowered. All the information is provided to the patient and their families and their carers, and then they are able to make an informed decision in terms of how they want to proceed further when they are receiving the treatment. So this part relates to also the core values which underpin, the delivery of health and social care, well-being services to the patient. Then we talk about some of them individually. So we talk about respect. Now, obviously, when we talk about respect, we are looking at, talking in terms of, say, for example, in this case, the care providers who are, who are going to work with the patient are expected to respect, the unique worth of the individual. They, for example, in this case, acknowledging their individuality and also treating them with, respect, in terms of showing compassion and respect towards their values and their beliefs. And this, let's say, respect that they show towards the values and the beliefs of the person makes them feel, makes them, I would say, makes the patient feel essentially important. That yes, my needs and preferences and my beliefs and values are being taken into account, and the treatment is being adjusted or is being provided, which is tailored to meet my, requirements, and that has more involvement from the patient in terms of receiving the treatment. Then we talk about partnership. Partnership obviously involves working with a lot of different individuals In some cases, this is a collaborative approach, because when we talk about delivering some of these services effectively in health and social care, sometimes collaboration between various stakeholders, is required. So stakeholders would mean the healthcare providers, social workers, your patient families, and obviously community organizations. So sometimes you would see working in partnership allows for a more holistic approach. And this holistic approach to care addresses not just the medical needs, but also the social, emotional, and other, environmental needs or factors which are required for the patient to get better. One such example is that when you go to hospitals, you generally see that in hospitals, there are provisions made wherein patients can, come out of the ward, they can sit, they can go into a bit of a garden or a green area, and they are in touch, or they are able to be in touch with the nature. Now, these are things which have been done over the years, because when we look at patient undergoing surgeries and the patients trying to recover, you would generally see that the environmental side of factors are also very important. So the constant visits by the family, the near dear ones, looking at being able to wheel them around on a wheelchair, take them around to a garden or a green area, to a cafeteria. Those are other factors that are being looked at in terms of partnership, because here the nurse, the doctor, the healthcare worker might not be directly working or providing the care, but when families or near dear ones, or essentially friends and other carers who have been taking care of the patient, to come and visit, then it provides that social, emotional, and environmental factors which come in, which allow the patient to get better. And obviously this involves partnership, this involves collaboration. So when patients are undergoing operations, you generally see that visiting hours are allowed. Doctors and nurses encourage families and of the patient, or friends of the patient, to come and visit, and that is for social and emotional support. So partnership again is very important when we talk about the patients getting proper treatment, and it becomes one of the core values that need to be looked into when we talk about improving lives of patients getting better. Then we talk about safety. Safety is another important, value that we need to talk about, because one of the things which is a part and parcel of, the NHS constitution, and when we look at the 7 principles, is that every sort of treatment which is provided needs to be safe. That treatment needs to be effective, and that is related to the standard of excellence and professionalism which, the NHS staff would have in providing the high quality care, but at the same time that care being safe. Any sort of medication which is being provided, or any sort of service being provided, is already means tested. It is already there's a lot of research which has gone in, and obviously when these are provided to patients, it is to ensure that these services are safe. They are going to be effective, and they are going to be focused on obviously the patient experience. So here, when we talk about safety, in general, we also relate to the Health and Safety Act of 2000, essentially Act of 1974, which is called the HASWA. It was revised, in 2000, in 2008, and the Health and Social Care Act relates to some of the policies and regulations which are also at the heart of the values which the NHS has, in terms of ensuring that safe and effective treatments are provided for health and well-being services by the National Health Service. So these are going to be the core, values that we look at. But when we discuss these core values, and what we are looking at is providing now arguments or supporting, let's say, I would say justifications to say why these values need to be underpinned, or arguments that we are providing, or lacks in legislations which have been created to ensure that these values help in the delivery of health and social care services to the patients. So these values are important, that we need to understand, and how we look at underpinning these values with some sort of support and justification is using acts and legislation. So Equalities Act, person-centered care theory, We look at some of the values that are going to be directly, referred here, like respect and dignity, partnership or collaboration, health and safety, Act of 2000, 2009, sorry, 1978, and the Health and Social Care Act of 2008, which ensure that anything that is being provided, any service, any sort of let's say provision for services which is being done for patient care is safe and effective, and that would meet some of the will support some of the core values which the health and social care professionals or people working with the NHS have to work with to be able to deliver value to the patient. So these are these values reflect the overall commitment of the staff, the organization, partners, or people working in collaboration with the NHS to ensure that the treatment being provided, services being given for health and well-being, or in general, any sort of procedures and operations or procedures being carried out, they are safe, effective, and are focused on patient experience and patient care. Is that okay? Any questions on this assessment criteria?
Okay.
Okay, so let's look at the second one, second assessment criteria. The second assessment criteria first talks about that we need to identify. First is let's look at identifying, and then we need to discuss. First, we will identify, then we will discuss. What are the key ethics or ethical, things that we need to know in health and social care, and then how do we use these ethical principles and values to be able to deliver health and social care services to patients. Now when we talk about in general ethics in social health and social care, what do we mean by ethics? Ethics are essentially nothing but standards. These are standards which are created, and they have a purpose that they are based on, say some sort of principles. So here, when we relate it directly to and contextualize it directly to the NHS and health and social care and the context of this, we studying in this unit, what we are looking at is the ethics part of it are going to be what are called standards, ethical standards that are created for a particular purpose, and these ethical standards would be based on the seven principles of NHS. And these seven principles of NHS would essentially be looking at providing us guidance to kind of be able to then provide these services to our patients. Now, when we talk about ethics in specifics to the aspect of health and social care, so when we talk about these ethics, there are going to be four, which we are going to talk about. First of all, in the ethics, we are going to be talking about autonomy. We'll also talk about beneficence, we'll talk about non-maleficence, and we'll talk about justice. These are the four elements that we talk about in ethics that we need to understand. So when we talk about, these four main ethical standards in terms of providing services to the patients, what we are looking at is these four principles or standards being used to create approaches of how these services are going to be provided to the patient. And these approaches are going to be the most, let's say, appropriate, effective, and safe approaches, which allows the patient to receive the treatment, to get better, and obviously get back to their normal routine. So when we talk about ethics, we will be there is it's a wide scope. We can talk about ethics for healthcare regulators. We can talk about ethics for healthcare professionals, people who work within the sector. We can talk about ethics which are basically related to the NHS in general as an organization. There could be ethical standards or ethics related to doctors or the nurses, the healthcare workers. So lots of things, but the idea here is to understand them from an overview point of view or macro point of view. And what are these ethics? These ethics would be something that we would need to adhere with, we would need to follow, and these ethics would underpin the social healthcare service delivery in the NHS. That means they would be looking at helping to create a framework which would basically then give us some pillars that we will follow. When I say some, there are four pillars: autonomy, beneficence, non maleficence, and just is what we will follow and practice when we deliver our services to patient. So for example, when we look at medical interventions, for example, if the patient has had an operation, it's under observation in the ICU, and then the patient gets discharged from the ICU to a general ward, that means things are going well, they are going as planned, and in some cases, after this, the patient vital stats, as they stabilize, the patient would get released from the hospital. And then there'll be some aftercare which needs to be provided for the patient to follow through in terms of medication, in terms of care provided by social workers. And that would then lead the patient to start going back to leading a normal life. Now, in some cases, when we do generally see that if there are medical interventions which are needing to be provided because things are not going as planned, then in those cases, these interventions would be aimed at improving the health and quality, or of the health and quality of the service that is being provided, which will finally affect how the, a patient receives the treatment. So when we talk about things not going right, then in those cases, interventions have to be done. And these interventions, when they are done, they follow these four core principles. For example, autonomy. Now, the principle of autonomy recognizes that there is individuals which are undergoing treatment or receiving the treatment, they have their own rights. They have the, when I say have their own rights, what I mean by that is they have the ability to be able to make their own decisions about their care and treatment. Sometimes you have patients which are diagnosed, for example, with, say, a particular heart condition. Now, the GP might recommend that you need to see a consultant after maybe an angiography or an angiogram is done, or an ECG test is done. It is discovered that this patient has a block in the heart. Now, before the operative surgery happens, whether it's going to be stenting or bypass, what will happen is the patient will undergo some sort of a consultation with the medical staff at the hospital. There might be a clinical nurse involved, the consultant involved, the surgeon who's going to carry out the surgery would be involved, and some of the care staff, or maybe the head nurse would be involved in having a consultation with the patient's family, and also, the patient and the extended family who are called. Now, why this is done is because the patient has the right to decide whether they would want to treat this with medication or they would want to undergo surgery. Now, the doctors and the consultants and the other staff, nurses and head nurses, are responsible for providing information and transparency. And sometimes what they will do is show what kind of stenting is to be done, or what would be the best process that we'll follow. You need to go under general anesthesia. These kind of things would be explained to the patient and their families. Now, after this explaining has been done, there might be some documentary paperwork which is also given, and then the patient is asked to agree on and then sign that paperwork. They might also discuss any sort of complications which can occur or can occur, and in those cases, the course of action, that this is what the doctor will do or the surgeon will do, will also be decided and given as options to the patient. Now, no decision is going to be made that, no, you need to go undergo surgery or you need to go do this, or there is no other option, this and that. All the information will be provided, and the patient and their family would be given full autonomy to decide whether they would want to undergo this treatment, and whether they would want to undergo this particular surgery. So in such cases, one of the main ethical standards which relates to the principles of the NHS is primarily to ensure that information is provided to the family members in order for them to understand how the services would be delivered. But at the end of the day, it will be the patient who would decide whether they would want to go undergo this treatment or this surgery or not. And this, in cases wherein people are incapacitated, people with, for example, mental disabilities who are not able to make the decision, The Mental Capacity Act of 2005 ensures that patients who lack this capacity to be able to make an autonomous decision are supported in making these decisions, in most cases by their family members, and in some cases, even a court appoints a specific person who then liaisons with the other family members and the people who are involved to decide on the best possible interest of the patient or best possible alternative for the patient. So this is a most important part, that in when you work within the National Health Service in whatever job role, one of the things that you need to do is ensure that you are able to provide accurate and factual information, and then the decision making part of it is left to the patient and their families or their carers to be able to decide whether they would undergo this treatment, take this treatment, or what would they like to do. And that part is called the autonomy. So you have to respect the autonomous, autonomy or the decision-making ability of the patient and its families by providing the information. And that is one of the main ethical principles that the, healthcare professionals or people working within this sector have to follow. Is that okay? Now, the second bit that we look at is beneficence. Now, if we look at the meaning of the word beneficence, beneficence basically is defined as an act of charity or mercy or kindness. Now, what we want to be able to do in relating this to medical or ethics in general, when we talk about, NHS or medicine in particular, say for example, medical services in particular, what we are looking at is the obligation of the doctor, the GP, the person who is involved in providing the care or the services to the patient, to act as they would act to benefit the patient, and also the treatment that they're going to prescribe is going to benefit the patient. So here, what they are going to be looking at is talking about, the use of their abilities to be able to ensure that the treatment that they prescribe or the procedure that they take them through is going to benefit the patient. It's going to support the patient in terms of getting better. So in practice, if I have to look at how is beneficence practiced in healthcare, what we will say is, for example, the principle of beneficence would require nurses to balance potential benefits and the risks of any proposed treatment. So, as a person working in the NHS, what I would need to be able to do is basically inform the patient about what could be the action, what could be the benefit of this treatment, and what could be the drawback of this particular treatment. And in such cases, we are required to basically discuss what could be involved in undergoing that treatment in terms of risks, what could be the side effects, and if at all, say for example, these are let's say things that you are aware of, you need to make them make the patient aware of these things. Simple example, when I say the principle of beneficence and ethics, for example, sometimes when patient undergoes surgery, they need to be told that, and I'll stick to the example of a heart surgery, assuming the patient agrees and they say that, okay, I don't want to go for stenting, but I would look at a bypass. Now, one of the things which the doctor and nurses would need to follow in the principle of beneficence is to explain the risks which are going to be in the proposed treatment. Now, one of the things which the nurse or the doctor in this case would explain, the surgeon would explain, is that we'll have an incision in your chest, and that incision at some stage, when we stitch it back and close it, would leave a mark, and that would be there, for your rest of your life. That won't probably go away. Now, that is something that is an action that or information that you would need to share with the patient and explain what could be the harm of that when they undertake the bypass procedure as a way out. So that would basically explain to them that although this will be sealed and everything would go fine, but for the first few months you'll have to have precautions to be able to look at while bathing so that water does not seep in. The other would be that there is a scar or a mark which will remain for life, And that scarring, which will happen because of the surgical procedure, would be difficult to be removed. It will remain with you throughout your life, is something that you would need to explain as a risk or as a drawback of this, operation, or as a drawback of the bypass. And that would be related to, the principles of beneficence. That means you are requiring them to understand that these are the potential benefits and drawbacks of the proposed treatment. And this would be the act of kindness, or act of, say for example, let's say, being openness and fair, that you are going to tell the person or the patient that these are the benefits and drawbacks, or dangers or risks essentially of this operation, and these could be the side effects that you could have, and they would be reflected in the ethics, when we talk about beneficence. Is that okay? Any questions on this?
I want to ask, what if the person doesn't have any family or anyone to stand in when that decision is being made?
So basically, in such cases, the Mental Health Capacity Act,
Yeah.
or the act, essentially ensures that the court then appoints a person in its place, wherein the person, is unable to make decisions. So relevant authorities, including the court, would step in, and they would then depute or nominate a person who would be actually making the decision in, for the favor of the patient, or keeping the interests of the patient in mind. So basically, in those cases, what you will generally see, the authorities or the court in some cases would step in, and they would nominate a person who would be working towards the, working on behalf of the patient, to be able to help him make that decision. In some cases, if the patient is totally incapacitated, then the person will be briefed, on the situation in detail, and they would then be required to take the best possible decision, which would be beneficial for the patient in such conditions. Okay. Now, the third point that we need to look at is non-maleficence. So when we talk about, let's say, beneficence, we are looking at the act of kindness, justice. But when we talk about non-maleficence, we are basically referring to, you know, uh, say, for example, in this case, when we look at the obligation, of the doctor or the person involved in providing the treatment, to ensure that they are not going to put the patient in harm's way. So sometimes, say for example, sticking to the bit which I have discussed, that assuming a patient is diagnosed with serious blockage in arteries, and all the three arteries are blocked, the doctor recommends an open heart surgery, because the three main arteries are 80% or over 80% blocked. Then in those cases, stenting would not be effective, or obviously not solve the problem. So in this case, the doctor would need to make a decision and make a recommendation to the patient and their families, to say that bypass seems to be the best possible option in this, in order to remove the blocks in the arteries which are there in the heart. And that would, obviously, in most cases, doing this would basically then prolong the life of the patient, and not have the patient have heart attacks or any serious conditions. Now, while let's say proposing this treatment and coming up with this plan, it is the obligation under non-maleficence of the doctor and the surgeon and the team, the medical team, to ensure that the advice that they're giving is not going to cause any harm or put the patient in harm's way. That means is not going to risk the life of the patient. So this principle is reflected in the Journal Medical Council, GMC, council's good medical practice, that although sometimes these are the only, sometimes hard choices have to be made, and these choices tend to be the only option available going forward to help the patient recover from that disease or from that illness. But in some cases, sometimes this advice is not followed through, because what we don't want to do is have a situation where the patient has a can lose its life, or can be under the risk of losing their life if the surgery does not go as planned, or in some cases, the surgery does not say, for example, the surgical procedure, you're not sure about that it will bring that benefit, or be successful. So if I have to simply state, this principle would support, moral rules that let's not kill or cause pain or suffering to the patient and his family members, or incapacitate the patient by undergoing a procedure which might be causing more harm than causing benefit. So in some cases, the doctors have to look at extending their duty to be able to inform, the family members of the patient and the patient themselves, that some of these medical treatment and procedures, when they're administered, would basically be potentially causing, one would be potentially be risk would have a lot of risks, and the other is that the procedure might not allow for, how do I put it, they might have more risks than benefits which the patient is going to get from that procedure. So, in some cases, in order for the patient to make that decision, what they would do is they will follow the principle of non-maleficence, which means that they would be looking at giving information which would allow the patient to make that decision themselves, that although surgery is the only possible route, but this route also has, certain, let's say, risk associated, which could be more harmful than benefits that the person would get after the surgery. So this is a core principle of medical ethics, which doctors specifically, have to follow, or patients, doctors essentially, or nurses, or consultants specifically have to follow when they are giving medical advice, which is going to put the patients, or would involve harming the patient, or in some cases, have more risks essentially than benefits in the treatment that they are prescribing. So this part is, quite important, because sometimes you have to look at difficult treatments, but the difficult treatments might be more risky. And in such cases, if loss of life or risk to loss of life is predicted, then in those cases, what will happen is that the doctors would need to abide by the fact that although we are going to provide this treatment, but we don't want to provide and go that far, which puts the life of the patient at risk. The other bit that we look at, the fourth part we look at, is justice. So when we talk about justice in particular, in terms of, four principles that we talk about in terms of, ethics related to healthcare. So when we talk about justice in particular, what we are looking at is, in terms of justice, when we talk about, the definition of justice, and specifically related to medical ethics, what we are looking at is the justice part of it would refer explicitly to any sort of, how do I put this? So the justice part of it would be that, the underlying principle would be that we will weigh up what is ethical and what is not ethical when we provide services in terms of treatments to patient. So in general, when we talk about ethics, what we are looking at is that we are looking at, under justice as a core part, we'll be looking at ensuring that all patients will be treated fairly and with equality. That is one of the principles of the NHS. But in ethics side of things, when we do discuss this, what we are looking at is that the concept of justice would come in, wherein it becomes fundamental to providing care to an individual, and irrespective of, their background, and where they come from, their belief or religion or whatever, the principle would be that the NHS provides and develops all its policies on the fact that it's able to deliver and provide fair services to everyone who requires them at any given point in time during the course of their lifespan. And this is primarily done to ensure that the NHS services are free and fair, and they are going to be effective, for the patient to be able to, get better. So, although what I would want to do is basically, give an example. Let me see if I can, give an example in this case. So, when we talk about, say, for example, justice, I could relate this to say sometimes, what happens is that the doctors have to give the information to the patient's family first, that everything has gone well, but there are these side effects which could happen and the patient would take time to recover. So sometimes when they have to break the news, in terms of certain things, they might approach the family first, then probably going to the patient or allowing the family to disclose or divulge this information. But when we talk about this, when this is supposed, if at all this happens, then what the doctors or the surgeons in this case, referring to the same example, they have to ensure that they have interpreted and interpreted the information and on the circumstances of the patient fairly. They've acted appropriately to treat the person, and in terms of treating the person, they have taken care of some of the ethical principles of ensuring that, assuming sometimes, and I'll give you a specific example here, assuming you're, going back to the same example of the patient having all the three arteries blocked. Now, when actually performing the operation, the main aim of the operation was to look at doing three bypasses. But during the course of the operation, the vital signs of the patient start to deteriorate, and obviously the procedure is not going as planned. Then, in those cases, the justice side of thing would be that the doctors decide that, okay, we will conduct and do only one bypass or two bypass, because although we looked at the situation, the reports and the the ECG and the angioplasty reports, it was suggesting that the patient's heart elasticity, pumping, and the hemoglobin and all those things were fine. But when they start the actual surgery, they find that it is not going to be possible to do the three bypasses that they had planned. So in such cases, the principle of justice would come in, because what the surgical team and the surgeons would do is they will follow what is called the clinical ethics to justify that the reason why they have not gone and done the three bypasses planned is to safeguard the life of the patient and to ensure that there is no impairment, for example, in any sort of functions after the surgery, and no negative drawbacks which the patient would have. So what they will do is they will justly follow certain, let's say, norms or principles which are prescribed as per their procedure in the General Medical Council, to say that we have carried out the procedure to the best possible aspect to ensure that the patient's life is prolonged, or in some cases, does not have any negative drawbacks. So in this case, they have applied what is called, fair and equitable practices to ensure that the patient is getting the best possible service, which allows the patient to get better, but are not risking the life of the patient by carrying out the surgery as it was planned to do the three bypasses, even after even after knowing that this would not be possible. But if you carry that out, then you're not relating to the ethics of non-maleficence, wherein you're not putting the life of the patient at risk. But at the same time, what you're trying to do is use justifiable service and resources to be able to carry out this procedure, which will benefit the patient and also not put the patient's life at risk. And that would be the part that we would need to look at when we talk about, justice in the ethics side of things. Is that okay? So basically, in the discussion of the second assessment criteria, what we need to look at is what are ethics. We need to look at defining these four ethics of autonomy, malfeasance, non-malfeasance, and beneficence, non-malfeasance, and justice, and then related to how they are helpful in providing health and social care or well-being services to the patient. And how does these four ethical standards or principles allow the patients, to get the best possible, fair, and effective treatment without putting them and their lives at any risk when such procedures are or treatments are to be provided to the patient. Is that okay? Any questions on this? Is that understood? Any questions on this?
Yeah, it's all right.
Okay.
It's all right. Yeah.
Okay. So say, for example, if I have to say in a nutshell, how do we understand these, in say small or little, as little as possible words? So non-maleficence basically means let's do not harm. Any procedure or anything that we do would mean that we are not going to harm the patient or when they undergo, some sort of treatment. And when we talk about beneficence, we are looking at essentially, if I put a slide in here and if I define these with the ethics side of things with 4 words. So if I talk about beneficence, what we are looking at here would be essentially best interests of
The
the
benefits of the
patients,
patient.
right? So here the idea is to provide the best possible treatment. When we talk about autonomy, what we are talking about here is the respect and dignity of the respect and dignity of the patients, essentially respect and dignity. And then when we talk about justice, what we are looking at is the fair and equitable distribution of resources and treatment. So sometimes you plan something, but if it is not going to be met, then what you do is you decide what is what is fair and what is just, and then basically, look at doing that treatment so that it is not putting the patients in harm way. That means not risking the life of the patient. But in this aspect, the treatment that you do go ahead and perform would essentially help in improving the life of the patient in terms of the, surgery or the operation that you're doing. And then we can also mention confidentiality, because there are some parts of it in the treatment that we are bound to respect, which is the privacy, of the individual. So we cannot discuss, say, for example, the data or some of the conditions of the patient with somebody else without their permission or without the permission of the family. And this would involve that personal and sensitive data essentially is going to be kept confidential. And unless a consent is provided, you would not be discussing this in detail or diverging the details of this to any other third party apart from the patient. So there's a bond between the patient and the carer, or patient and the nurse, or patient and the doctor, and that needs to be kept confidential. And then last but not the least, in some cases, we also say accountability in terms of the ethics. The accountability part of it is, obviously taking responsibility of one's action. Sometimes procedures, operations do not go as planned. And in this case, we have to take responsibility of one's action. And that basically is dependent on the decisions that you take. So in some professions, what you generally see is when the person is undergoing surgery, you're asked to sign an undertaking saying that, although everything is being planned by the clinical surgical team, the doctors and consultants and nurses, if there is something, the risk factors are explained to you, and then if you still want to go ahead, then you sign a document which basically says that they are not going to be, when they're prosecutable, or they are not going to be liable. And in those cases, the accountability side of things is coming, because the doctors and the nurses and the consultant who are involved would have to divulge all the information in a very fair, uh, honest, transparent manner, so that the patient and the family can decide whether they want to undergo and take that procedure or not. And even after that, in some cases, when it is done, risks are explained, potential benefits and drawbacks are explained, and then the people, the person undergoing or the patient undergoing procedure is asked to sign a undertaking to say that we will ensure the conduct and practice, of the highest possible standards but if there are eventualities or risks which are involved, and that puts the patient at a potential danger or risk of losing life, then they would then be not held accountable. So in this case, it makes it very, very important for the clinical team or the team which is going to carry out that procedure, to ensure that they divulge all the information in honesty, transparency, and explain the risks and benefits of undergoing the surgical procedure, so that accountability at both ends, from the patient side and from the medical team side, is clearly established, and users who are going to be involved in that particular process or the procedure would then be accountable. And in some cases, you see sometimes what happens is that if these slippages happen, and if there is a loss of life, you'd see nurses, doctors being struck off the medical register, or the NMC, which is Nursing and Midwifery Council, or the Journal Medical Council, or British Medical Association. And those are, actions which are taken by the regulators, because, proper standards and procedures have not been followed, which has led to the loss of life, or long-term implications for the patient after the surgery. So these are ethical principles or standards that underpin the NHS principles and values, which are required to be able to give or deliver what is called the social and healthcare services within this assessment criteria. Is that okay? Any questions on this so far?
No.
Okay, good stuff. So that brings us to the end of this particular learning outcome. And what we've done is we've comprehensively covered the values which are required to be understood in terms of NHS values, and the principles which would then be used to basically provide health and social care services and well-being services under the social and welfare community provision. We'll be looking at meeting up tomorrow to discuss, the assignment for this particular unit. And if you think of any questions, or if you have any queries, then please feel free to ask. We'll do a bit of a recap and then go into the assignment discussion. Okay.
Thank you.
Thank you for attending, and I will see you guys tomorrow.
Thank
Okay,
you.
thank you, Rema. Thank you. Bye.